BRESELIBET is a Phase IIb randomized prospective clinical trial that looks at patients with classical Hodgkin lymphoma, primary refractory patients or patients in first relapse. And the objective of these trials is to try to demonstrate a superiority of a salvage chemotherapy strategy, which is ESHAP, supplemented with Brentuximab vedotin, which is a monoclonal antibody, drug conjugate that has demonstrated to be very effective, a single drug initially for patients with relapsed refractory classical Hodgkin lymphoma. So Brentuximab vedotin ESHAP is randomized in a 1-to-1 fashion against ESHAP with the primary objective to demonstrate that Brentuximab vedotin ESHAP is able to achieve a higher metabolic complete remission rate in this population of patients after 3 cycles of this combination. Understanding that achieving a metabolic complete remission is the best disease status that we would like to have in a patient who is a potential candidate for an autologous stem cell transplant. The second part of the study that was not presented in this poster tries or looks at the potential feasibility of Brentuximab vedotin single drug consolidation therapy instead of autologous stem cell transplantation in patients that have achieved a metabolic complete remission. So 150 patients were included in the trial. The trial was already closed for recruitment in October 2023. Randomization, as I have mentioned, was done 1-to-1. The clinical characteristics of both groups of patients were quite similar, and the trial met the primary objective because the metabolic complete remission rate in those patients that were randomized into the BB-ESHAP arm was significantly higher than the metabolic complete remission rate of those patients that were randomized into the standard of care arm. In terms of toxicity, the toxicity profile was not different between BB-ESHAP versus ESHAP. And in terms of stem cell collection that was included in the design of the trial, basically for the potential future autologous stem cell transplantation was able to be done without significant issues in both arms of the trial. So basically the conclusion is that Brentuximab vedotin ESHAP is able to achieve a higher rate of metabolic complete remission. This is the first prospective clinical trial that looks in a randomized fashion the potential benefit of combining chemotherapy with Brentuximab vedotin. And the other important thing is that the complete remission rate that BB-ESHAP was able to give in BRESELIBET is very similar to the one that the Spanish group of lymphoma achieved in a Phase I/II prospective clinical trial.